And good evening, everyone. And welcome to this episode of Ask the Doctor. Your health is important, where you can ask any healthcare question that you like, and hopefully we'll follow up on some of the things that are concerning to you. If you listen to my segment this morning on the Rickey Smiley Morning Show, where we talked about climate warming, how this heat is negatively impacting everybody, and we're going to continue that conversation right now. So thank you very much. All right. So welcome once again. We are so glad to have you here. And we're going to talk about, once again, if you feel like it's hot, it is hot. It is very hot. If you feel like you say to yourself, wow, I don't recall having these types of temperatures as I was growing up and coming along. I don't recall them. And you're also absolutely correct, because we have higher temperatures the past year than we have ever had in the history of the world. And this year, we are already breaking those records. Over the past week, the July 4th holiday, we had over 500 temperature high setting records broken across the United States. This is happening in the North, in the South, in the Midwest, in the East, and in the West. So the entire United States is being negatively impacted. So you say, well, Dr. Collier, it's hot. So what? What does this mean for us? You have to understand the risk that you are at in a warm environment and how it affects your body and your mind. It has a negative impact on the way your body functions. The way your body cools itself off is by sweating. When you sweat, your brain and your heart sends blood to your skin surfaces so that perspiration can evaporate and cool down the blood. That's how you drop your temperature. Well, that puts an extraordinary burden on the heart as well as the skin. And also, you're shuttling blood peripherally when you need blood centrally to your organs and to your brain. So this can create a condition, a heart attack or a stroke. It can create a condition called acute kidney injury. The kidneys are kind of like a car engine. And if you run it with low oil, it does damage. And over time, the engine will seize and have permanent damage. That's what happens to the kidneys. And you can ultimately end up in acute kidney failure. Now, this is for people that have good health, regularly healthy people, not counting people that have comorbid conditions or already have been diagnosed with diabetes, high blood pressure, high cholesterol, etc. So if you're a high-risk individual, you really need to protect yourself. That basically means staying cool, keeping cool, staying out of this heat. You may think that it's warm enough. And don't forget also our furry friends. If you have to take your dogs or pets out for a walk, particularly your dogs, the concrete may be so hot it literally can burn the pads of their feet. So you need to keep them walking in grass. You need to take them out in the morning. You need to take them out in the evening once the heat of the day has resolved. Keep them off the concrete and the asphalt. And it's the same for yourself, because that concrete and asphalt radiates heat like an oven. And so it can literally bake you. That's where places that are high concrete cities like New York are having extraordinary heat, because it doesn't even cool off at night, because the concrete continues to radiate heat long after the sun has gone down. So this is a bad situation. If those don't think global warming is real, you're seeing it right now. You're seeing some of the dramatic weather, but you think every time there's a hurricane or a tornado, you say, oh my God, how many people are going to be killed? Guess what? More people die from the heat-related complications and heat injury, acute MIs, heart attacks and strokes, heat exhaustion, than ever die from hurricane action, floods, any other weather phenomena. More people die from heat than anything else. So you have to be cognizant of this. If you are unfortunate enough to not have air conditioning in your home, or you lose power. Sometimes when we use so much electricity trying to stay cool, you have a brownout or a blackout. The electrical grid shuts down because it cannot handle the amount of electricity that's being demanded upon it. So all of a sudden, you're in a hot house, a hot, dark house. So cool yourself off. Cool showers, cold showers, or baths are good. You can soak in the tub, and as many times in the day that you need to do that, you do that. Swimming pools are an amazing option as well. If you don't have air conditioning, use fans to blow the air across your skin. That makes it evaporate. It cools you down. So there is benefit from sitting under a fan, even if the air is not refreshing. But one of the things I talked about this morning, I spent this weekend poolside, hoping to relax, read a paper, have a cocktail, whatever. And just couldn't get comfortable because it was just so hot outside. The only time I really had comfort was when I was literally in the pool water. But even the pool water did not feel refreshing. It kind of felt like lukewarm bath water. And that's just not a good feeling when you're outside in a big swimming pool. So it is amazing that, how I basically retreated from that activity. My plans this weekend were to play golf. It was too hot. To play tennis, it was far too hot for tennis, and I just was not able to do that. So I basically did what all of us did: cooked outside, ate inside, and Netflixed and chilled, watched a lot of television. So I hope you had a great holiday weekend as well. So now let's get to it. So Haile, let's do our roll call. Okay, JW from Tampa, Florida. Welcome to the Ask Dr. MJ, Ask the Doctor Anything. Autry Matthews. Hello, Autry. Thank you so much for joining us as well. We appreciate you. Sean Big Time Green. Hey, from Monroe, Louisiana. Thanks, Sean. We appreciate you. Thank you for always tuning in. Loretta McNair from Aiken, South Carolina. Hi, Loretta. Thank you for being here. Sherry Gamble. Hey, Sherry, how you doing? Good to see you as well. Dwayne Gregg. Hey, Dwayne, checking in again. Once again, love that picture that you have right there. That's from the old Good Times movie. Glenda Everett, good evening from Warner Robins in Fort Valley. Hi, Glenda. Thank you so much. Warner Robins, Fort Valley. David Brown from Baltimore checking in. We got Baltimore in the house. Okay, we got Midwest. Now, let's look at Michigan. It's cold in Michigan. Where in Michigan is it cold? It's hot everywhere, Stan. Chris Goodgen, good evening from Greenville, South Carolina. Good join. Thank you, Chris. We appreciate you. Glenda Everett, good evening from Warner Robins in Fort Valley. Once again, Glenda, thank you so much for tuning in as well. Stephanie Thomas from Lancaster, PA. Thank you, Stephanie. We appreciate you joining in. You got $1 million smile. Katrina Watley from Birmingham, Alabama. Hi, Katrina from Beham, Bright Light City. We love Birmingham. Thank you so much. Stephanie Giles, good evening from Miami, Florida. Hi, Stephanie. Thank you so much for joining us. At least in Florida, it's hot, but you got a beach. Okay, hello from Raleigh, North Carolina. First time listener. Hi, S. Simone. We appreciate you being the first time. We want you to be a regular. Tell all your friends, tune in right now. Ask Dr. MJ on all social media, YouTube, Facebook, Instagram. H.C. Bell, first time chiming in as well. Thank you, another first timer. We really appreciate all the first timers because we hope you heard about it. We hope you enjoyed your experience this evening. Nikki Clark Smith, first time tuning in from Savannah, Georgia. Another first timer. Okay, thank you so much, Nikki. We appreciate you. AC Bell from Kannapolis, North Carolina. North Kakalaki in the house. D. Foster from Birmingham. Hi, D. Great picture. It's a pleasure to see you here. Cheryl Jackson, Cheryl, Arkansas. Okay, Cheryl, your namesake, Arkansas. We appreciate that as well. Mimi with you. Hey, Mimi, thank you so much for tuning in. It was a pleasure to see you recently, and we appreciate you. Sandra Tolliver, hello from Miami, Florida. Another Miami, and boy, I wish I was in Miami right now. Tanika Jones from Hampton, Georgia. Hi, Tanika, landside in Hampton, where it's hot. Hot as Hades in Hampton. Gabriel De Pina. Good evening, Doctor. Good evening, Gabriel. Thank you so much for joining us as well. Okay. Reginald R. Arrington. Okay. First time from Houston, Texas. Boy, this is great. Reginald, I really like when the men tune in. This is great barbershop discussion. Take the information. Everybody that's listening, I want you to take the information that you hear tonight and share it. This is your medical ready reference, but I want you to be the medical guru in your group gatherings, when you're sitting around with your friends, when you're having a cocktail, when you're playing cards, when you're gathering in any group. A lot of people are having family reunions right now. I'm having one in a couple of weeks. So if you are with people, have substantive discussion about your family history, about the history that you have, about health challenges or diseases. Ask questions about various types of medications that you may be taking or other people may be taking. Hi, Tom and Rich from Louisville, first time as well. Thank you very much. We want to make sure that you share the good news. Hello from Oklahoma, Robin Joseph. Hi, Robin, we appreciate you. Hi, Makiba. Oh, thank God, Miss Bolin. It's good to hear from you. We missed you last time. Glad you're in the house right now. Okay. All right, Holly, let's get to the regular question because this is your show. I'm going to take a sip. Okay, Earl Johnson. I was listening this morning. What's good to help bilirubin elevation and plantar fasciitis? Okay, bilirubin elevation is an indication that your liver it needs to be detoxed. And so, there's a thing called milk thistle. Milk thistle, that is a supplement, not a prescription medication, that is very good for liver and bilirubin health. That also could be an indication of gallstones or gallbladder disease. If you're having pain in the right upper quadrant of your abdomen, go put your finger on your belly button and then move to the right. Put your finger on your belly button and then move to the right. And when you do that, if you have pain in any of that area, and the pain also is very unique because the pain, instead of going around to the back, it feels it's going straight through, like you have a pole or a poker stuck through your abdomen. That is indicative of liver and gallbladder disease as well. Now, plantar fasciitis is a problem with the bottom of the foot where the tissues there are too tight and sometimes too dried out. I highly recommend supplements like omega-3 fish oil that literally kind of oils the joints, and then foot massages to stretch out that tissue. You can do, just finger foot massages. There are these foot massage places everywhere now that do foot massages, like in 15-minute increments, and they're very inexpensive. And they are one of the best investments you can make in yourself, self-care, self-love. But then in anti-inflammatory, ones I recommend will be Motrin, Advil, Aleve, basically ibuprofen, 200 milligrams. Aleve is naproxen sodium, 220 milligrams. 2 of either of those on regular schedule, 8 to 12 hours, will give you some relief. Some people will take a bottle, like a bottle of water, and freeze it, and then just put it on the floor and roll their foot back and forth on top of it. You can do that also with a rubber ball, with a tennis ball. All those things will give you some relief. Also, get the person that loves you, somebody who likes you a little bit or loves you a lot, to give you a foot rub while you're just sitting there watching television together. Do each other. You do them, they do you. And you'll, one, that's very good bonding experience. And two, it's just a great feeling while you're sitting there watching television. It brings you closer together. It might be a prelude to a hotter portion of the evening. So mutual foot rubs, one of the things I recommend as well. Great question. Noah Zachary, what are the symptoms of bladder cancer? Well, the 7 symptoms of cancer include pain, include bleeding, some change in your urinary content. Your urine can be dark, your urine can be light. It can be difficult to pass your urine. But bladder cancer is a big leap. There's so many other problems that you could have before we would go to bladder cancer. Basic plain urinary tract infections, chronic cystitis, which is a chronic inflammatory infectious disease in the bladder area. So lots of things that starting off with a simple urinalysis to analyze what's going on. And then, further evaluation necessary to rule out bladder cancer, which could include scans like an ultrasound, a CT scan, and or an MRI, or even a direct look with what's called a cystoscope, where they go through your urethra with a scope that's about the size of a straw or a pencil. They dilate it, they go in there, and they can literally look around if there's anything in there like a polyp or a lesion that needs to be biopsied. They can do that, because the only way to make a definitive diagnosis of cancer is to get a biopsy. Anything else can be possibly, must rule out, consistent with. But until you have a biopsy and the pathologist has told you that it's cancer, it is not cancer. So let's not go the cancer route. There's too many other options first. If it ultimately ended up being a cancer diagnosis, you still got to go through those things anyway before you get to a cancer diagnosis. So those are the things you would look for, Nora. So good luck with that evaluation, but don't sit around guessing. Go ahead and make an appointment with a primary care doctor first off, then possibly even a urologist, not a gynecologist, a urologist, to see what's going on down there and check it out. Great question. Cindy Hill, I've lost 100 pounds on my jaw. Is there anything I can do to firm up my thighs without surgery? Hi, Cindy, 100 pounds. Congratulations. You have lost a person. And now you see some of the problems that you can have, particularly with loose skin. So to firm up the thighs, again, good exercise. Collagen is good. Supplements, oil supplements, vitamin D and omega-3 fish oil are excellent for skin health. You can take vitamin E oil and rub it on the skin to keep it moist and supple so that it doesn't just turn into loose skin. And you can make a good source of vitamin E oil is the Dollar Tree store, where everything's $1.25. You can get that and rub it on the skin, massaging it. There are other technologies available. I have a unique technological piece in my office called the laser liposuction, the strawberry laser. It can tighten the skin as well. There are other technologies that tighten skin by freezing it, by ultrasound, and by microwaves. So all of those things can tighten skin depending upon how much you're talking about. But if you have excessive skin flaps, you're not going to be able to tighten that up. You're going to have it surgically excised. And unfortunately, most of the doctors that do that won't take insurance to do it. You have to pay for it out of your pocket. But if you have skin folds that are causing skin rashes and other type of dermatological problems, then that makes it a medical problem, and your health insurance will cover having the skin removed if it comes to that. So that needs to be evaluated by a dermatologist and or a plastic surgeon to determine where you are in the process of what you can do, and they'll give you the best advice on that. But it's difficult to answer that question, but I can just visualize after having lost 100 pounds that you probably got some excess skin in that area because your thighs were rubbing together. Now there's a gap between them. That skin, it's hard to get that skin to tighten back up once it's been stretched that far. So good luck with that, Cindy. Keep us informed. We want to hear about that. But you can start off with your primary care. Like I said, get somebody to have a look at it. Don't just talk about it. Make sure that you get undressed and they can physically look at it. Again, or a dermatologist or a plastic surgeon, depending upon. But a dermatologist can probably refer you to a plastic surgeon, or just Google plastic surgeons that performs skin removal and see, go to those websites, look at some of the videos that they have on there, so you get a better understanding as to what your options are. Great question, Cindy. Okay. Lynn F., I'm probably going to need cataract surgery. I'm concerned about being able to see when I drive. So would I be getting a lens for distance? Lynn, it depends. The great thing about it is when I was coming along, people had cataract surgery because they basically were going blind, and the cataracts are basically the lenses in your eyes become opaque and you cannot see through them. They're no longer clear. So they would take the lens out. When they took the lens out, they would give you these Coke bottle glasses. There's a cartoon character back in the day called Mr. Magoo, and he'd have these thick Coke bottle glasses on that you could see under, but they made you look extremely funny. In the movie Harlem Nights, I know that Red Fox character, the one when he's playing a dealer, he had on some of those thick kind of post-cataract surgery glasses that made him look ridiculous. But you could see. But guess what? Technology has improved. First thing they did was they take the old lens out and put new lens in there. Then they give you corrective lenses. Then somebody said, guess what? Wait a minute. We can correct the vision with a new lens when we install the new lens. And so they take the old lens out, pop the new lens in. It takes 20 seconds per eye to do that surgery. They really have to stretch it out to make it seem as worth as what they charge you for it. But it's instant 20/20 vision. It is absolutely amazing. And amazing enough, I'm looking forward to getting to the point to need that. And anybody that's in their fifth or more decade, 50s or higher, starting to get cataracts, your lenses cloud, that's just a function of age and dehydration over time of the lens structure proper. But when you get that down, your eyes are crystal clear. You look 10 years younger, 20 years younger in the face because now your eyes are just clear, and it changes the way you look. So you don't squint, you don't strain like you used to before you get the surgery, and it changes your life. But it can correct your vision sometimes. Sometimes you still have to have corrected vision. It's usually the other way around, not for distance, but for like reading. But sometimes you can read elegantly and appropriately without additional lenses. So it just depends on how well they're able to correct your vision. And they, this precise science. They do a computerized analysis, measure with laser beams, and it gives an exact version of what your focal point should be, and they should be able to correct your vision, definitely markedly improve it. So don't be afraid of that. They usually will only do one eye at a time in case you have a problem, a side effect, an infection, something happens, and you lose vision in that eye after having the surgery. So that's why they don't do both eyes at the same time. You get one, when that one heals, you can get the other one done. And believe me, I've seen this surgery as being a lifesaver and a life changer for a lot of people. Great question, Lynn. Laura Kate Davis, can you mix lipo with lupus meds? Hydroxychloroquine, 400 milligrams daily, meloxicillin. Yes, you can. Every lipo product that we have is perfectly compatible with any prescription medication. There's not a single one that Dr. Collier can think of that won't go well, because one, these are supplements and they're natural and they don't interact with other medications. So you can use any of the lipo products, particularly if you have lupus. Oftentimes you're having to go through rounds of steroids, which make you gain weight. And so the lipo products, the things I recommend, the lipo drops maximum strength. You squirt it under your tongue. You hold it under your tongue for 2 minutes, then swallow it. It works under the tongue. What goes into your stomach doesn't do anything for you. So you have to make sure that you hold it under your tongue long enough for it to be absorbed. And then our newest, latest, greatest product, our Lipo Nights. You take 2 capsules anytime after dinner. You go to sleep. It makes you sleep better because it has medication to help with that, melatonin, not medication, a supplement, melatonin, which makes you sleep. You get a good night's sleep. You do not make that cortisol hormone that makes you store abdominal fats or store fat in your abdomen, makes your abdominal fat increase under the muscle layer and above the muscle layer as well, which increases your chance for high blood pressure, diabetes, and puts you at a high cardiovascular risk. So the answer to the question is yes, you can use the Lipo Drops Max. You can use the Lipo Nights, even our Keto Max product, which puts your body in an artificial state of ketosis. It's the same thing that happens with the Atkins diet. That is also 2 capsules a day. I spread them apart, 1 in the morning, 1 in the evening, and that will optimize your body's response and weight loss. So if you're trying to maintain weight, it will do that. If you're trying to lose weight, it will help with that as well. But you don't have to worry about hydroxychloroquine or Lyrica or any other products doing that. You'll be fine when you do it. Great question, Lori. Denise J, how does subclinical hyperthyroidism act? Is there something to do to stop it from coming to the forefront? Yeah, subclinical means you're not having a lot of the symptoms that you can. But if you have hyperthyroidism, that is excess thyroid hormone, oftentimes caused by antibodies to your thyroid that your body makes. So it usually is an autoimmune etiology. It can be infectious as well. And so there are various things you can do. There's medications that you can take that will lower the level of thyroid hormone. The inactive thyroid is T4, which is converted to T3, which is the active thyroid hormone. So it's very important that you identify which hormone level is elevated. Because of this, the inactive thyroid hormone, and your body isn't converting it to the T3, then you probably be okay. You just need to monitor it. If it's T4 being converted to T3, or if the T3 itself is elevated or markedly elevated, it can result in a condition called thyroid storm, which makes your blood pressure shoot up and your heart rate shoot up, and it results in a heart attack and or a stroke. So very important that you keep that under control. The problem is most people won't take the medicine, or once their symptoms resolve, they stop taking the medicine. But you have to stay on that medicine continuously. I am okay with giving a trial of coming off of it to see what happens. But if you come off of it and your levels go up again, that kind of answers the question that you're probably going to have to stay on that medication forever. The other treatment option is to remove the thyroid in toto. You take the thyroid out, that fixes it. Then you have to be on thyroid hormone supplementation forever. That never changes. You will never come off that medication. But for some people, that is the only option. So you need to discuss that with your endocrinologist and then get a surgeon that knows what he's doing. Sometimes they take out a quarter of the thyroid. Sometimes they take out half of the thyroid. Sometimes they take out the entire thyroid. The thyroid sits in your neck here. And imagine a butterfly here. This is the butterfly's body. And the wings go here and here. And so they can take off wings on one side and leave the other side. They can take off, like I said, a quarter of the thyroid, or sometimes they take out the whole thing. And so it depends. There's a lot of other variables that will determine what your best course of therapy is. Okay, great question. Dee Foster from Birmingham, Alabama, home of Rickey Smiley. I also need to know how long I need to take the vitamin D before it helps with my hormones. Okay, vitamin D helping with your hormones. Vitamin D doesn't help with your hormones. Vitamin D has a variety of other benefits, including boost your immune system function, gives you strong bones, strong teeth, healthy skin, healthy hair. When your immune system is boosted, it decreases your susceptibility to various types of infectious pathogens. So no viral infections like the coronavirus or the flu or common colds, no bacterial infections like strep throat or pneumonia or skin pustules or risings, no fungal infections like toenail fungus, fingernail fungus, jock itch for men, vaginal yeast for women, athlete's foot. All of those things are benefits from the vitamin D therapy. You need hormonal therapy help. You need to take the Lipo HERS, HERS. Lipo HERS will help with your feminine hormones, help you feel more feminine, increase your libido, increase your sex drive, increase the intensity of your orgasms, all of those things. So depending upon what your symptoms are, there's a product for you. You need to go to the lipodrops.com website. Look at what you'd like to see. Look at all the products and see which one addresses the symptoms that you have, because we have lots of products on there that can give you the boost that you need. And whenever you tune into this, there's a discount process of purchasing product on there. So do that, check it out, and then get back with us for the next live Ask Dr. MJ program. Thank you, D. We appreciate you. Shauna Reed, I have rheumatoid arthritis. What can I take besides the methotrexate and ibuprofen to relieve inflammation and pain? Shauna Reed, that is a great question. One, rheumatoid arthritis is an autoimmune disease where your body makes antibodies and starts to attack and destroy your bones and joints. So in addition to having pain, there's literally destruction of the joints, and you'll see, people have osteoarthritis, they get big knuckles and their hands look normal. When you have rheumatoid arthritis, it attacks the joints, and you end up with deformities of the joints and loss of function of your hands or your knees. The most common areas are knees, hips, and hands. So, but it can attack any joint. So methotrexate is first-line therapy for that. Ibuprofen is what's called an NSAID, a non-steroidal anti-inflammatory. Any of them can help. Tylenol, which is not an NSAID but strictly for pain, can give you relief as well. Natural things you can do. The vitamin D, the body's natural anti-inflammatory. At our dose, the doctor's D dose is 5,000 international units per day. Then omega-3 fish oil, which kind of decreases inflammation, kind of heals the joints, soothes the joints, oils the joints. So imagine if it's creaky and squeaky and you put that oil in there and it loosens it up and makes it feel much better. So those are a couple of natural things you can do. Other natural anti-inflammatories, dark cherry juice is one. Then there's curcumin or turmeric, which comes in tablets, capsules, powders, teas, so many different ways you can get them. You might want to go to a naturopath or a place like the Vitamin Shop or a place that sells supplements and look at some of the things that they offer for inflammation, but particularly with that. But Shauna, there have been major breakthroughs in the treatment of rheumatoid arthritis with a class of drugs called biologics. These things are so amazing. They started off being indicated for rheumatoid arthritis, but now they're using them for everything from irritable bowel syndrome to Crohn's disease, eczema, asthma, because it addresses basically anything that has an autoimmune component to it. And rheumatoid arthritis is one of them. I am sure they will ultimately be utilized for people with a diagnosis of lupus and a variety of other autoimmune diseases because they work so well. So Embrel, EMBREL, was the first drug on the market to do that. Again, started off for rheumatoid arthritis only, but people had other conditions and then they got better as well. Then they sought the indication for those. So look under biologics, BIOLOGICS, to treat rheumatoid arthritis. It is a new class of drug, does not do damage to any part of your body except calms down your body's response, autoimmune response to an autoimmune disease like rheumatoid arthritis. It does decrease your immune function. So you would need to do something like take our Lipo Immune, which would boost your immune function and help prevent you from getting an infection. So if you have a history of hepatitis A, B, or C, you need to be very careful in taking any of those class of drugs, and also if you have a history of tuberculosis. Other than that, if you're not otherwise immune compromised, ask your doctor about biologics and treatment of your rheumatoid arthritis. Sometimes they're not going to talk about it if you don't mention it. Sometimes they're not used to or comfortable using this class of drug because they weren't trained before these came out. Now they're out, and so they may or may not know how to use them. But it's nothing complicated. Some are oral, some are injectables, some are infusions, which means you got to have an IV inserted in your arm, and the medicine drips in over an hour or so, and then you may get that as often as once a month. Some are just one time per year. So great information out there, Shauna. You do not have to suffer. But, we start off with the minor things, the methotrexate, the ibuprofen, to relieve your pain or some other anti-inflammatory. Great job. Trushin, my 16-year-old has been dealing with the pilonidal cyst for over a year. What are your thoughts and what should we do? Have it surgically excised. That fixes the problem. Opening it up and draining it has not worked, obviously, because it basically becomes an abscess, and the treatment of an abscess is to open it up and drain it. So the pilonidal cyst usually is located in the butt cheeks, or between the butt cheeks, right over the sacral bone. You can, when Dr. Collier excises them, I excise them using an elliptical excision, which means it's not just slicing it open. I take out a segment that looks like this. Again, maybe more almond shaped, and how big it is depends on how big the pilonidal cyst is. It's actually one of the first surgical procedures I was taught by my mentor, Dr. James Densler. Called me to the emergency room when I was the resident on call. Said, Collier, this is a pilonidal cyst. This is how you treat it. So I learned very quickly, and in my lifetime, I have done and removed many of them. It is a surgical problem that needs to be treated surgically. Unfortunately, sometimes doctors are reluctant to do that nowadays. They just want to put you on antibiotics or pack it and try to get it to heal by what's called secondary intention. But if you've been dealing with this for a year now, it needs to be fixed. And that means you need to have a surgical consultation as to, or a dermatologist could do it, but usually a general surgeon is the way to go as well. But there are primary care doctors that have been trained to do it. I'm one of them. But at this point, I would say have a general surgeon look at it and look at the surgical options. Great question. Ton Rich, is collagen good? What should I buy if so? Collagen is good. There are various types of collagen. There's injectables, there's orals, there's gels, there's jello type. Collagen comes in a product that's like jello. Comes in capsules, comes in tablets, a variety of different products. It depends on what your objective is and what you're trying to accomplish. Most people take collagen for the health of their skin and nails. Most of the time when it's injected as a filler to take away wrinkles and fill in spaces, give you a more appealing face or other areas in your body that may have lumps and folds that you want to remove. So this is depending upon, again, what your objective is. You might want to get a consultation with an esthetician, a person who specializes in this, and they can tell you what and make recommendations. If you're just getting it for skin and nails, whichever product floats your boat. I don't necessarily recommend one above the other. I think, like, again, the various preparations, there are collagen gummies now. Again, pills, capsules, gelatins, gel, all different types. Try any of them or try all of them. See which one you like. See which one works best for you. But it is not an instant. It's not like you take a dose in whatever fashion. The next day you're feeling better or the problem is fixed. It takes a while, weeks to sometimes months. But once you have been on it and you're benefiting from it, it will give you that benefit. It works wonderfully. It's a great supplement, but it just depends on, again, your sense of urgency, what you really need, and what the problem is. So if it's just for hair health, nail health, skin health, then you can take any of those preparations and try it. Great question, Tonton. Candace04, what are my thoughts on weight loss surgery? Weight loss surgery is a definitive option with the GLP-1 injectables. That's the Ozempic, the Wegovy, the Mounjaro, the Zepbound. Those are the 4 shots that are available right now. The Zepbound and Wegovy have a weight loss indication only. The Mounjaro and the Ozempic, you must be diabetic to get those medications. But the weight loss that you get from those products is 20 to 30 pounds per 100 pounds of weight. That is the equivalent to weight loss surgery without the surgical risk and without the recovery time. You take the shots, you lose the weight. Both of them will result in, if you have a dramatic weight loss, sometimes excess skin. So you have to start treating your skin during the weight loss. Don't wait until you've lost it and now you have problems with it. So that would be vitamin D oil, massages, stretching, anything to get that skin to tighten up. And that will be the biggest issue. There are clear indications where weight loss surgery is the preferred method. If your weight is over 400 pounds, then weight loss surgery is probably the best option for you because it would just take too long with the shots. The shots will do it, but it would just take too long. And by the time you do all of that, you could have paid for the surgery and gotten that benefit. Understand this, the surgery and both of them, the shots and the surgery, and the surgical options would include a full and complete gastric bypass, which alters your plumbing and is life-changing. And then there's the gastric sleeve, which is what Dr. Collier recommends. The gastric sleeve is basically where they take your stomach and fold it onto itself. Most of the time, if a person is obese or morbidly overweight of 100 pounds, their stomach has been stretched to about the size of a 2-liter Coke bottle. So visualize that and think about folding it into itself to the point, like I take a piece of paper and fold it like this, like this, like this. And now you have a space that's about the size of a banana. That is now your absorptive surface and how much calories you can observe. And once you eat and that space gets full, you feel full. One thing about bariatric surgery is it's called a surgical cure for diabetes. We're not sure what the neurohormonal mechanism is because people that have diabetes have suffered from diabetes for a very long time on moderate to high doses of insulin. They get that surgery and 2 days later they're off insulin. So it's not the weight loss because they haven't lost any substantive or significant weight. But the diabetes has basically been cured. More importantly, it's controlled. But basically now it's cured because you're off the diabetes medications. So there are clear indications for that, why one would be better than the other. Dr. Kai gives a full lecture presentation on the benefits of both and to see. But like I said, if you're over 400 pounds, then the bariatric surgery is probably the best option for you. And the surgical procedure that I would recommend is the gastric sleeve. There are rare times that I would recommend a gastric bypass. If you ever watch My 600-Pound Life, that is the procedure that they do the vast majority of the time. They do gastric sleeves as well, but they do the gastric bypass most of the time. It's called a Roux-en-Y, where they cut your stomach out basically and then attach your esophagus to the first portion of your small intestines, bypassing that, which makes digestion very difficult because your stomach, the digestive acids in your stomach break down food, and your stomach is an active organ. It literally contracts in multiple pathways in 3 different angles to help mash food, help mix it up with the dissolving acids and dissolve it and turn it into the slush that you see. Like if you get nauseated, you vomit, that's what's in your stomach. Now, if you take the stomach out, you don't have that option anymore. So you're not getting that benefit. So it's harder to digest food. The food has what's called a colloidal effect, which means you have lumps of food. If you don't chew it well and take small bites, it goes right through you and gives you explosive diarrhea. There's never a time that's good because you cannot control it. And so it's a lifestyle change. You really have to be prepared for how you're going to be as far as your relationship with food for the rest of your life if you get a gastric bypass. With the gastric sleeve, you're just eating less and you lose the weight. And that is what's amazing about it. That process is the thing I recommend of the two, but you can't eat. I've had people had gastric sleeve, had surgery, lost 100, 200 pounds. And then 3 to 5 years later, they gained it all back because the stomach is a living, breathing organ. And now you have turned it into the size of a banana, but you keep eating and it gets bigger and it gets bigger and it gets bigger. Before you know it, you're back to the 2-liter Coke bottle size and you gained all the weight back. So you have to continuously work with a nutritionist or follow a diet plan once you've had that surgery. And you have to be disciplined enough to not keep eating and embrace the sensation of feeling full. Once you feel full, you stop eating. Because if you keep pushing the envelope, eventually you will start to gain again. All right, great question. Reginald Ayrton, I had triple bypass in February. Congratulations. I just ordered fat burners while sleeping. Are these okay to take? Yes, they are. Again, compatible with that. That will help you lose weight and help decrease your abdominal fat, which is what puts you at risk for the cholesterol plugging your coronary arteries, which is what the triple bypass is. There are only 3 arteries in your heart. The left, which splits into 2. You have the left main, which splits into 2 branches and goes to 2 portions of your left ventricle of your heart. And then the right, which covers the right side of the heart. The right side has a short pathway. It pumps blood to your lungs. Blood comes back to your heart from the lungs. And the left side pumps blood all over your body. So that is why when people have a right-sided heart attack, that's called a minor heart attack, because you can lose full right-sided function and just the left side pushing blood through will get blood to your lungs and get it back to your heart. It's not as an efficient process, but it does work. And you can survive that. You're not 100%, but you will survive it. If you have a obstruction of the left main, that's called the widowmaker, because that's called the massive heart attack, and most people do not survive that. So if you get a branch, either of the other branches on the left side, so remember you have the left main, then it has two branches. Either one of them gets closed. That's what you had bypass. So if you had triple bypass, you had three of those. There were obstructions in those three, and they basically you can stent them. You can put a balloon in there and open it up. But if you have bypass, that means those things didn't work or weren't an option. So they basically just jump over. They take a vein from your leg, take the artery where you have the obstruction, and they literally put a spacer over it. So the blood flow now goes past the bypass. That's why they call it bypass surgery. It goes past the obstruction, which cannot be removed, and gives you good blood flow, and usually will restore you to a 90-95% functional area and do well. Sometimes those will reclog as well. So it's very important that you take cholesterol lowering medications in the class of statin to stop those arteries from getting plugged up again, and just continue to follow a low cholesterol diet as well. You would also benefit from vitamin D and omega-3 fish oil, which is very good for lowering triglycerides, lowering your total cholesterol, increasing the HDL or good cholesterol, and lowering the LDL, the bad cholesterol, which is the thing that makes you need a bypass. So it lowers the LDL. So those are all great things and great options for you. And the Lipo Nights is a good option for you as well. Look at the Lipo Drops Max if you're trying to lose weight, because it's out of the equation. You put it under your tongue, it's absorbed. It changes the way your body metabolizes fat and stops it from turning into fat. When you eat food as fuel, it metabolizes it, so it goes through you. So it's not stored here. It's not stored across your back. It's not stored under your arms. It's not stored in your abdomen. Remember, lose the muck and top with Lipo Drops. That's the catchphrase. Okay, great question, Reginald. Stephanie Thomas, what are the benefits of soursop? Can I eat chia seeds? Yes, you. If you have nut allergies, chia seeds are not nuts; they're seeds. So you should not have any cross reactivity, but I can't guarantee that because you could be allergic to those as well. So, do a test, try one or two, see it, have some Benadryl readily available. But again, chia seeds are not nuts, they are seeds, and nuts are a totally different category. So you should not have a problem with that. But allergies are never that way. You always have something. Okay. Next question. Great. Okay. Rhonda Holiness Young. Holiness. I love it. Hello, Dr. Collier and everyone. Is there a cure for tonsil stones after surgery? Tonsil stones are basically nothing but coagulated mucus. The mucus will, particularly when you lay down, the mucus from your sinuses goes down. It solidifies, gets hard, and it just collects itself in those pits. And they call them tonsil stones, but it's really just a hard coagulated mucus. And so sometimes you literally have to physically extrude them with a Q-tip or some apparatus like that. The thing that I would do is to keep that mucus from doing that. The way you do that is to take a mucolytic like Mucinex, Y-phenicin, which makes thick mucus, thin and watery, and allows it to drain easily. And also I would use a nasal spray like Flonase or Nasacort, or one of the other steroidal nasal sprays that will prevent you from making that mucus, particularly at night when you go to sleep. There's also a thing called the nasal navage, Navage, which literally rinses out the sinuses. They have a saline packet that works amazingly well to clear those sinuses and helps postnasal drip. You do that at night before you go to bed. Use the steroidal spray, the Flonase or the Nasacort, and then a non-sedating antihistamine like Flonase. Like Zyrtec, Loratadine or Claritin, Xyzal or Allegra. All of that, you may do one or a few of those things. You may have to do all of them to keep maintaining these tonsil stones and stop them from collecting like that. So that's the answer to the question. And again, if you've had, surgery also removes the pits that they're gathering in. This used to be standard therapy. Dr. Collier had his tonsils taken out when I was 5 or 6. And everybody in my generation that did that don't have these problems now. Unfortunately, now the younger generation, they didn't get their tonsil taken out. And now they have all these issues as adults they never would have had if they just had their tonsils taken out the first time or the second time that they had problems with their tonsils. I don't know how many times I had them, but by the second or third time, they came out. And so, but the thing is, our antibiotic treatment for tonsillitis is very good now. And you can take antibiotics when they flare up and they'll get better. And 2 weeks later, you're back to normal until the next time it flares up. But once a tonsil is full of infection and pus, then they really need to come out. And so I would see an ENT doctor and don't be shy about the surgery. They taking out tonsil adenoids will change lives. It really can make a big difference in how you respond. Otherwise, you're going to be doing those things that I talked about, which is a fine non-invasive option, but it's something you're going to have to do because otherwise they will flare up and you'll get those. Okay, great question. That girl C, Sean C, do you have anything to help with heartburn and or sleep apnea? Those two things are not necessarily mutually exclusive. Heartburn is when you lie down and the acid from your stomach. Remember I said the stomach is moving in 3 different directions. And when it squeezes like that, food goes down, but it also can come back up. And the problem is that the esophagus does not have a protective lining like the stomach does. The stomach has a mucus lining so that it literally does not digest itself. If that mucus lining breaks down, that is how you get stomach ulcers. Well, if that acid gets above the ring that closes at the bottom of your esophagus, there's a valve that closes off the stomach. If that valve gets loose, stretched, strained, or opens up by any mechanism, and that acid starts to come back up in a refluxive manner, that acid literally starts to digest the esophagus, which is basically just meat, just like it would a steak or any other food that goes down into your stomach. That can put you at risk for a variety of different problems. If it comes up too much, it can affect your esophagus. It can affect your epiglottis, which blocks off your breathing apparatus so that you don't aspirate food or saliva or liquids when you're drinking, and can cause problems. You get edema in the throat mechanism, and even the sinuses. And then now you have sleep apnea because your pathway of breathing is obstructed by swollen tissues inside your mouth and inside your throat. So one, to treat the heartburn, great products to do that. Most of them are now over the counter. Nexium, Prilosec, Pepcid AC, Tagamet, all of these are great options that used to be prescription and now are available over the counter. They work wonderfully. Try those first. Simple things. Take small bites and chew food thoroughly so that it's not hard to digest and it gets out of your stomach and down into your small intestines so that it cannot reflux under those circumstances. Then don't lay down on a full stomach. Do not eat anything within 3 hours of laying down to go to sleep or laying down to take a nap or laying down for any other reason. You don't want to do that because you will reflux it up. So you need to eat dinner earlier and I'll go to bed later. The problem is now we have developed as a culture late night eating. We eat late at night and we go right home and go to bed. At minimum, it converts all of that food to calories and fat. And now your abdomen starts to become bigger. At maximum, you end up with problems like acid reflux. And that acid reflux can cause stomach ulcers. It can cause, you do what's called an erosive esophagitis, your esophagus gets so damaged by that now it's not flexible, so food doesn't go down easily. So when you swallow, there's a wave that goes down your esophagus, kind of like a snake, if you've seen a snake move. If you get scar tissue in there, it gets blockages in there. Food won't go down, it gets stuck. And then that food will just sit there. And sometimes the acid flashes up and dissolves it. Other times it comes back up. You got to throw it up. And they have to sometimes literally go in there and stick a tube in your esophagus to dilate it so food can get down and get past that. Once you start to have those kinds of complications, you got a big problem because this is always going to be an issue. And you literally have to be conscientious every time you eat or drink anything. The substance, is it liquid like water? Is it thick like a milkshake? Is it chunky? Is it high fiber? Things that are difficult to digest. Things that are difficult like a steak. You may now have to eat chicken and fish more often, or take those things out of your diet, period. Just basically on a liquid diet. All of those things are lifestyle changes that you may have to suffer from if this goes untreated. So start off with those over-the-counter anti-acid. Some are what are called proton pump inhibitors. They stop the stomach from making acid. The other are H2 blockers that block the acid that your stomach makes. That's the Pepcid and the Tagamet. The proton pump inhibitors are the Nexium and the other medications. So those are the things that you have to do. But don't try to treat this yourself. It's easy enough to partner with your primary care doctor to get this under control. Okay, don't. Yeah, it sounds like you've already been living with it for a while, and so don't let this, which now is a minor annoyance, become a great healthcare problem and put you at risk of altering your lifestyle and your quality of life. Great question, that girl. I appreciate that. Ivy Mitchell. Okay, I have been hearing a lot about how one can clear out their arteries holistically. What can you do this, and what supplements would you recommend work best? Ivy, I'm sorry to tell you that is a myth. There is nothing that clears out the arteries holistically. Once a cholesterol plaque has formed, it is like concrete. It will not move. We have no technology that can go in there and remove that. Even the class of medications that we put people on, the basic objective of those is to stop it from getting worse. They do not cause what's called plaque regression. It just doesn't happen to any significant amount. And there's no magic pill, gel, juice, supplement, natural, holistic, whatever that does that. If it did, everybody would know about it. I tell people all the time, if you see a product being advertised late night, or it's on the internet, or it's something that just seems too good to be true, and it's supposed to do miraculous things that, I said everybody would know about it, one, and two, everybody would use it. It wouldn't be difficult. Everybody would be trying to get this if it does just that. It wouldn't be a secret. It wouldn't be something that only a few people know, or a few practitioners of holistic medicine share, in the rest of the world. The pharmacology, the pharmaceutical companies, and the doctors don't do this. We would. If it was available and it was something that worked, we'd use it. So again, now, what can you do to help optimize your cardiovascular health and help keep your arteries as clean as you can? Again, the body's natural anti-inflammatory, omega-3 fish oil, and vitamin D. Those are the two supplements that I recommend, one, and two, that I also take every day. Take every day myself. So these are products that I want to talk about. These are products that I believe in, one, and utilize. And they are the top of the line products. When we talk about the omega-3 fish oil, for instance, omega-3 fish oil, the best ones come from what are called bottom feeding fish. The problem is the fish eat everything that's on the bottom. That includes poisons, toxins, poop, anything that's on the bottom of the body of water, the lake, the river, the ocean. These things eat, and it gets embedded in that fish oil. So to get a high quality oil, you have to remove it. If you have a fish oil product and you open the bottle and that fish oil product smells fishy, that means it's not been purified. It's not a good product. It's not one of the best products. So, and if you take a fish oil capsule and you look through the capsule should be crystal clear. If the capsule is cloudy and smells fishy, it's not a purified product. Doesn't mean it doesn't have good omega-3 fish oil in there. It may, but it also has got a whole lot of other stuff in there that you don't want. So our product is purified. You open the bottle, it does not smell fishy. If you look at the capsule, it is crystal clear. It is one of the best, if not the best, omega-3 fish oil products that's out there. Also, most omega-3 fish oil capsules come in 500 to 1,000 milligrams. To get the benefit of omega-3 fish oil, you need to take 3,000 to 4,000 milligrams per day. So that means if you're taking 1,000 milligram capsule, you got to take 4 of them a day. That's a big pill burden, particularly if you're also taking other medications. Ours has 1,480 milligrams per capsule. That means you can take one in the morning, one in the evening. And when just taking one, you don't get the fish smell. You don't burp fishy taste up. It doesn't come out in your pores, so you don't smell fishy. Your underarms don't smell fishy. Your private parts don't smell fishy. But you get all the benefits of the anti-inflammation that you get with an omega-3 fish oil. So that is why our products are so appreciated by those that take them. Sometimes you can always find something cheaper. If you look online, you go to Amazon, you go to Walmart and Sam's, but you're not going to find the quality that you're seeking. Our objective is to provide a high quality product that gives you the benefits that you desire without any potential side effects. Nobody wants to smell fishy. There's never a good time to do that. So if I got a choice between smelling fishy, my breath smelling fishy, my body smelling fishy, and then possibly helping my arteries versus having a pure product that does all those things, helps my arteries and my cardiovascular health, but doesn't give me those side effects, that's what I'm going to go for. So go to get the Lipo Omega, greatest fish oil product you can get, at the Lipo Drops website, lipodrops.com, and look at the other products that are available, and you will find some things that I'm sure that you might not even have thought about. our sea moss product now. Very good. Everybody's asking about what can I do for altered cognition. I feel like my mind is slipping. I'm getting short-term memory problems. Do I have dementia, Dr. Collier? Well, our sea moss product helps with all of those things and gives you a variety of other anti-inflammatory processes as well. So check out the Dr. Sea Moss also on their website. Okay, great question, Ivy. We appreciate you. Tamika McDaniel, with the new weight loss out there, Ozempic, Wegovy, do they all have side effects of constipation? They can, because what they do is slow gut motility. So it makes you hold the food longer, which is why you feel full and you are not hungry. That process goes on throughout your entire GI tract. Your GI tract starts in your mouth, your esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. That is all multiple organs, but it's literally one space that's all connected. And remember I said, from the first time you swallow, that moving like a snake, there's a muscle, a wave that goes through. It's like a snake that moves throughout your entire body. Well, those medications slow that down and or stop it. So the food just sits there. And when food sits in the large intestines, the purpose of the large intestines is the reabsorption of fluid. So that food gets drier and harder and the stool becomes more difficult to pass. So simple things that I recommend too. Probiotics make a major difference in your life when you're taking a product like Ozempic or Wegovy. It makes a major difference when you do that. So we're going to, highly recommend that. Eating yogurt on a daily basis, that helps tremendously. And then you're going to have some great benefits when doing that. So we like to add yogurt and or probiotics to that. When I write a prescription for one of these products, the injectable GLP-1s, that's Ozempic, Wegovy, etc., then I make sure that this is not a problem. That if you add the probiotics, you will not have GI upset. You can also benefit by drinking enough water to make sure the stool doesn't get too dry and too hard. So your water intake needs to probably double. And then sometimes you may even have to take a stool softener. But guess what? I have found out that taking our Lipo products, the Lipo Cleanse and the probiotic, Dr. Collier takes one of each in the morning and one of each in the evening. Now, there are other treatment options. You could take two at one time, 2 in the morning, 2 in the evening. But I found that the best combination for me is to take one probiotic, one Lipo Cleanse in the morning, one probiotic, one Lipo Cleanse in the evening. And that improves GI function amazingly well. The Lipo Cleanse is not a laxative, but it allows you to have large, easy to pass bowel movements with, that will help, particularly when you're under the influence of medication like the Ozempic. So go to the website, get the Lipo Cleanse, get the Lipobiotic, add those to your treatment options, and you'll see that this constipation will not be a problem for you. Okay, next question. Debbie Bell, I purchased Lipo drops and nighttime capsules. I'm 20 to 25 pounds overweight and also take blood pressure medicine. Should I be concerned while taking the meds I purchased? They're not going to have any negative effects on the blood pressure medications or with the blood pressure medication. There won't be any interactions from that perspective. But if you lose 20 to 25 pounds, you may find that your dose of blood pressure medicine can be lowered because that will usually help. Don't expect to come off the blood pressure medicine. That probably is not a real option. But if you find that you're doing that, you may find that you can lower your dose of blood pressure medicine if you're successful in a 20 to 25 pound weight loss. So work with that. Try to see how you're responding to your blood pressure medication. And if necessary, monitor your blood pressure. So get a blood pressure cuff. You can buy one of those from Amazon or just go to the drugstore. You can get a decent one for 40, 50 bucks. You should have one anyway if you have high blood pressure. Monitor your blood pressure and see if with the weight loss, your blood pressure is going down. The good thing is you're not going to drop 20, 25 pounds overnight. With the Lipo drops and night capsules, it might take you 2 months to do that. And then you have time to see how your blood pressure is being affected. And so what I would not do is stop taking blood pressure medication totally. I might take half the dose. And see how that affects you. If you start feeling that your blood pressure is getting too low, take your blood pressure medicine at night before you go to bed. So it's already in your system working. You don't get a dramatic shift in your blood pressure in the morning when you're doing that. And then consult with your doctor. That kind of weight loss, he may change your prescription medication for your blood pressure or take you off of it totally if your blood pressure is now controlled. So there we go, Debbie. Great question. Okay, this brings to an end this episode of the Ask Dr. MJ, Your Health is Important. Ask the Doctor Any Question segment. We appreciate you. For all you first timers out there, we really appreciate you. Tell all your friends about it. Have them sign up as well. Tell them, say, look, it's Wednesday at 6:30 p.m. Eastern Standard Time. You need to go get your healthcare information, and then share that information. If you heard it tonight, you heard real medical information that you can count on as being 100% true. So if you share it, don't hesitate to share it. You are now the medical liaison. You're the medical ready reference. You're the medical apostle. You go out and preach good health. We'll see you next time. Thank you so very much.